We're live. My name is Dr. John Robinson.
And I'm Dr. Christina Bosch.
And we are euphemistically known as
the Sex Docs.
We even have a little placard here to prove it. We are the Sex Docs.
It's official now.
Yes. So today we're going to be talking about thyroid, and this is a part 2 of a 4-part series. And we are live as well as live.
Yeah, sorry.
Christina had it on. Oh, that's good. We can see all of that. So this is part 2 of 4 of Thyroid Sexy. Mm-hmm. So today we're getting in a little bit more detail. And let me go through a couple of basic housekeeping things. Always remember to share the video. Please share the video.
Please share the video. We have a lot of fans out there, repeat watchers. Thank you so much. But we'd love to really insist, if you can love to insist, that you spread the love. Thank you. Share it.
Spread the love. I like that. Okay. And also turn on your notifications so you know that when we are going to be live, which again is every Tuesday at 12:30 Arizona time. And again, the topic for today is, do I have a thyroid problem and the thyroid system? So the thyroid system is our unique system in how we approach thyroid disease. So today we want to just talk about very specifically, how do we determine one way or another if we have a thyroid issue? Mm-hmm.
Yeah. All right. So we'll get into it first by people who suspect they may have a thyroid issue.
Meaning like symptoms.
Then, like symptoms, okay.
Yeah. So let's do that. So what are some of these symptoms? There's quite a few. With the thyroid, we call this the great pretender. It can be a lot of different things. Mm-hmm. So fatigue, weight gain, staring at food and gaining weight, we always say. Losing your hair, losing your eyebrows, particularly.
Lateral one-third.
Lateral one-third. There's several things. Libido, which is a big concern for us around here, making sure we're enhancing libido. A lot of times we just think about testosterone or maybe estrogen or sex hormones with libido, but it very much could be your thyroid.
Right.
What else? These three are really important. I'll let you take care of those.
When we're talking about sexual health, we are often talking about reproduction as well as just your menstrual cycle. So for those females out there that are having difficulty conceiving, then sometimes it's as easy as addressing the thyroid, sometimes in very special cases. But no matter what, when you're having difficulty with conception, you want to make sure that your thyroid is not just normal, but optimal.
Yeah, here's a little bit of history. It used to be that fertility clinics, back in the early part of the 20th century, when they had first diagnosed low thyroid in the late 1800s and kind of understood what that was, but in the earlier part, I'd say the first half of the 20th century, fertility clinics actually largely used thyroid hormone. So they knew that there was something going on with thyroid, and they would give thyroid hormone to be that thing to be able to help induce fertility.
Yeah. I'd like to back up for a moment and talk about the notion of weight gain. A lot of patients will say, I have no problem with weight, or I'm not overweight, or I don't feel fatter than I want to be. So they think that thyroid isn't the problem. Yeah. I think that it's really important to remember that you don't have to be overweight to have subfunctioning thyroid. It has a lot to do even with those people that are physically fit and exercising regularly, but don't see that their body responds as they would like it to, then that would still be reason to explore the thyroid.
That's a great point.
Is this concerning here?
I don't know. It could be your phone.
True. Just making sure we're not frozen. In the event that we're not frozen, then we'll keep forward.
Right. So back to what you had just said there, 66% of all women, most of the research shows that 66% of women will gain, or men, or low thyroid patients will gain weight, but 1/3 don't. So that's a really important distinction. Yeah. Okay, what else do we have? Dry eyes, Zika, dryness, whether that's dry eyes, dry skin, or even vaginal dryness. We put this here because a lot of times, again, we think of sex hormones when it has anything to do with sort of waist and below. We're thinking estrogen or testosterone. And a lot of times it really is thyroid. It's the same thing with menstrual difficulties. Sometimes many times the issues have a lot to do with thyroid, even though it has something to do with menstruation.
Yeah, and this is important, again, that crossover between sex hormones and thyroid hormone. Think of what is probably one of the most common therapies for irregular menstrual cycle or painful menstrual cycle. Younger and younger patients, we're seeing them on birth control, which is a very typical, I think, conventional approach. And I would say if you do have a young female in your life that's having difficulty with her menstruation, perhaps it's just cramping beyond what we would consider normal or what you would consider normal, then again, have her thyroid and her thyroid health looked at.
Absolutely, very good point. So gastrointestinal problems, bloating, water retention is a really, really big one. Thyroid hormone has a lot to do with keeping water in the appropriate compartments. Anxiety, depression, mood swings, irritability.
Yeah, just mental health in general, from a mental and emotional component, but also from cognition, clarity of mind, clarity of thought, memory. We think of this with estrogen and testosterone as well, but especially with the younger patients, a lot of times that will be their thyroid is just not functioning optimally.
Yep, absolutely. Okay, so that's some of the symptoms,
right?
And maybe that's some of you out there. I don't know.
So this is a segue into, I think I have thyroid issues. What do I do about it?
And so one of the first things you want to do is go see someone that's going to be able to get the appropriate labs for you. So let's talk about what those labs are today. One of the first things that someone would check is something called TSH, or thyroid stimulating hormone.
And thyroid stimulating hormone is not produced by the thyroid. Where does it come from?
It comes from your pituitary gland, a small little gland just in the center and the base of your brain, and that secretes a message. It's like TSH is like an email message that's communicating from your brain to the thyroid to actually stimulate the thyroid to make thyroid hormone.
Yeah. And then can you talk to our watchers a little bit, our viewers a little bit about the range of TSH? Because I think this is a really important point, because most physicians are going to use TSH as the primary tool. You're going to come in and say, I have all of these symptoms, I suspect it's my thyroid, and they're going to say, okay, let's check your TSH, and then what happens?
So yeah, and that's normally the only thing that they're going to check.
Exactly.
And the ranges for us about 0.3 to 2.0.
Right.
Now in TSH, the higher the number goes, the more low functioning the thyroid may be. So it's a little bit opposite of what you tend to think. So if the number for us goes above 2, then we start thinking even more strongly. The high end of the range typically is about 4.5. So for a lot of doctors, it's got to be way above 4.5 before them to even consider there's an issue.
Which this is a point of controversy, even I think in the world of endocrinologists or doctors that specialize in hormones, because many doctors I think will rightfully argue by the time a person is at a 4.6 and you're officially flagged as abnormal, you're quite symptomatic. Yeah. So this is why for us, when we say for us, this is the range of optimal thyroid health. That means, as Dr. Robinson already said, once you're above that 2.0, we really want to dig a little bit deeper.
Yeah, that's a great point too. Again, you said optimal, and that's always the way we're looking at things. How do we make things really, really awesome, taking people from healthy to really super healthy? So total and free T4. So there's two different types of thyroid hormone. There's T4 and activated T3. Both T4 and T3 will give us an idea about thyroid function, maybe one more than the other.
And this is an important hormone to look at when we're talking about typical thyroid replacement, because some of us are already on thyroid hormone replacement. So if they're looking at labs and they still think, I'm hypothyroid, then what might we see?
In terms of the labs?
In terms of the labs, because they're taking
thyroid
hormone.
You're really questioning me a lot today.
Sorry, yeah.
You're like, what is that?
Quizzy.
Yes, you do. So am I passing? Am I doing okay?
Wonderful.
Oh, okay, good. So what was the question? What did you?
What I'm trying to emphasize is the difference between, again, traditional thyroid hormone replacement.
Yes.
The labs are useful for patients that are also diagnosed as thyroid but still feel that they're not feeling their best.
Right.
So T4 and T3 help us, because sometimes
Yes.
T4 and TSH will be within that normal range, but perhaps T3 is not in an optimal range.
Yes. Okay, good one. Now I understand what you're asking. So, and Dr. Bosch is right. One of the things that we're going to focus on probably the most is T3, particularly the free version of it. Free just means unbound in the blood. And now T4 tells us a lot about production, but most patients, what Dr. Bosch is saying is most patients will already come on T4 therapy. So a lot of times their T4 will look halfway decent because they're taking something that contains T4, but the T3, and this is the most active form of thyroid hormone, the T3 is actually still low. So we can often see that.
And it's also important to see the T4 and the T3, not just the TSH, because we want to understand how well is that person converting T4 into T3. Remember how John said that T3 is the most active form. You want to make sure that you're converting that T4 and T3, either because you're not on thyroid hormone and you want to optimize your active thyroid, or because you are on thyroid hormone, but it's not properly converting into an active form.
Yes, and that's essentially what's happening. T4 converts into active T3. So reverse T3, we really like this one. Reverse T3, what this is a mirror image of T3. So regular T3 will kind of float through the blood and activate the cell. But reverse T3 is a reverse mirror image of T3. It comes up to the cell and the cell goes, I don't know what you are. And once that happens, that actually lowers metabolic rate inside the cell. So that's pretty important for us around here, because we're always looking at metabolism, and because thyroid hormone is the sort of sovereign of metabolism, it's really important to look at this particular number. This is a typical one that is almost never checked.
Right. And so what's the significance of that reverse action that we're describing here? Essentially, the higher your reverse T3, the more burden metabolically on the body. So we want to know that we are giving you thyroid hormone replacement, that your metabolism is being stimulated, and a great clinical marker to help indicate that that is the case would be monitoring and managing your reverse T3.
Yeah. You know, here's the thing about this. So from a range standpoint, we want to see this less than about 11. And the range can go up into the mid-20s or so, mid to high 20s. So we definitely want to see it less than 11 to be optimal. And if it's a little bit higher than that, not necessarily an issue. But why does reverse T3 go up? And this is what's really important. Reverse T3 goes up because of stress. So if we are under a lot of stress, emotional stress, even physical stress, even dieting will increase reverse T3. Because if you're dieting, your body will go out of its way to try to lower its metabolic rate, so it will increase reverse T3. And then therefore your metabolism goes down. This is the downside of long-term, real big calorie deprivation diets. It eventually will kick your butt by increasing reverse T3. We've seen this in a lot of patients. So the other thing I wanted to mention too about the reverse T3 is that, and this is what I think Dr. Bosch was getting at as well, if your regular T3 is even normal or optimal, but your reverse T3 is through the roof, then you're really presenting with a low thyroid state or low metabolism state.
The purpose for us of replacing that thyroid hormone therapy is really for, again, optimization of self. It's for an increase, a stimulation in your metabolism. So it's not enough to say you've got the labs looking pretty or you've got your thyroid labs looking pretty. You want even your lab analyses to be holistic enough so that your body, I mean, it's a brilliant system. The body is giving you clues. Yes, my thyroid hormone levels look good with this particular dose of replacement. However, I still have a strong inflammatory burden. You need to address that inflammatory burden. You had mentioned about the notion of dieting and reverse T3. This is a bit of a segue, but when a person is eating a super good and clean diet, but their digestion isn't good, then you may still have elevated reverse T3.
Absolutely, yeah. So this would be a far more comprehensive way of looking at things when we're adding that in. This also, by the way, if it's letting us know about stress, that's giving us a clue about adrenal function.
Right. Yeah.
So it's another sort of backdoor way of being able to understand adrenal function. So two other assessments here: anti-TPO and anti-TG, or anti-thyroid peroxidase and anti-thyroglobulin. These are those antibodies that have a lot to do with Hashimoto's. Next week we'll talk even more about Hashimoto's, but these are incredibly important to make sure we're checking to see if you maybe have an autoimmune condition called Hashimoto's.
Right. I just want to take a moment before we change the page to say I hope we made that a little bit less confusing. I always take a moment to say, please send out those questions. We love to answer them. Basically, the point of this overview is to say a few things. Number one, if you suspect that your thyroid is not working well, please arm yourself with a more comprehensive list of labs that you should take to your physician and strongly request that they order. Number two, if they do succeed in ordering them, please be aware that there's a huge difference between being normal and being optimal. Your ranges need to be optimal. And then number three is what we'll talk about next week, which is the importance of discovering whether or not there's an autoimmune inflammatory response affecting the thyroid, because that will definitely, it doesn't change the prognosis per se of thyroid disease, but I do think that it can change, that it should change the way we manage it so that the rest of your body's wellness is optimized as well.
Yes. You know, and real quick here on with these antibodies and what Dr. Bosch was saying about optimization, many doctors will see all of these other these levels here normal, particularly the TSH, and let's say they're looking at T4, maybe T3, and they're going to see those to be normal or maybe even optimal. But these antibodies are through the roof and very, very high, which could totally indicate what's going on with an autoimmune condition, but they often will not treat. If they see these elevated, but this is all normal, they won't treat, and we don't look at it that way.
Yeah, and I really like using antibodies in an initial screening because perhaps the person is subclinical, their labs are looking pretty good, and the labs we're going to talk about in a moment, maybe they're also looking pretty good, but if those antibodies are there, then that is usually a formula to say, if you don't get the rest of your lifestyle habits in check, then that thyroid dysfunction will usually manifest itself. So it's almost like having the gift of foresight. When you know there's antibodies there, then you can be that much more proactive.
Right. There's something going on for sure. Okay, and then of course a comprehensive hormonal view. What that means is we're not just looking at thyroid, we're going to look at your sex hormones, we're going to look at adrenals, we're going to look at insulin and blood sugar control, growth hormone. We're going to look at the entire comprehensive hormonal picture as well as just overall health.
Looks like we might have a question here.
Oh, what's the question? Let me see. It says, can you also touch on Graves' disease too? Christina, thanks for that, Christina. That's a great question. And what Graves is, now I'll tell you, what we're going to do is we're going to talk about autoimmune even more next week. But real quick, what Christina's asking about is anti-TPO and anti-TG. These are two antibodies to see whether or not the immune system is attacking the thyroid gland. If we see these elevated, that means that it likely will lead to low or hypo-low thyroid. Graves' disease, what Christina was asking, is about hyper-high thyroid. That's a different one, and that's called TSI. These are TSI antibodies, thyrotropin-stimulating immunoglobulins, which just has to do with Graves' disease. And in fact, this is over 95% specific to Graves' disease. So if we see elevated TSI, the odds of it being Graves' or hyper-high thyroid is really, really high. So we definitely do take a look at this if it presents. But mostly what we're talking about today is
low thyroid. It's just what's most commonly seen out there, although God knows we have worked with the hyperthyroid patients as well and are just as adept at doing so. So we'd be happy to talk more about Graves and again autoimmunity next week.
Yeah, and I'm glad you mentioned that, Christina. We'll make sure that we really focus on that because again we always go into Hashimoto's. We'll make sure we really mention Graves next week. So moving on. Oh, share this video. I don't know if we've mentioned that.
Good.
So how else are we going to assess the situation? We're not just simply going to look at labs.
Right.
Even our unique way of looking at labs or our optimal way of looking at labs still might not be enough, and we might need to do something else.
So we have a few tools in the office that we can use. Again, symptoms. We always talk about symptoms. Not just for diagnosing, but then also for management of your thyroid. We want to know that you're feeling well. Then the second set of tools that we use are going to be really assessing your metabolic function. If we can say that the thyroid is the master of metabolism, then having slow metabolism, which is measured through these two tests, would also help to solidify a diagnosis. So we have two tests that we use in office. One of them is the resting metabolic rate analyses, or the core review machine. And this is a test that we use. It's kind of like snorkeling. You put a mask on your face or a mouthpiece, and it measures oxygen consumption. And then the second test, and that one is fasting. I would say that it's the gold standard test.
Yes, it is.
But the environment for that needs to be perfect. You want to come in as early as possible in the day. You have to be fasting. So if you don't have the time or the ability for that test, which is gold standard, then we would move on to whatever's just below gold, but still pretty darn good, which is the Thyroflex.
Yes, it's, I don't know, zirconian or something. It's not, I don't know. Anyway, that's diamonds. This is the Thyroflex. So where the resting metabolic rate test that Dr. Bosch was talking about, that's called indirect telemetry. That's one way to check it. It is the gold standard. They're called metabolic carts. They use them in hospitals all the time. But what is about 98% accurate to the gold standard of indirect telemetry is the Thyroflex test. We really love this test. A little bit or a lot more simple in terms of its application. You don't need to be fasting. You don't have to be away from your thyroid medication. It's just you are right then and there. It takes about 4 minutes to do this test. And what it's doing is it's checking the reflex speed in your brachioradialis reflex. So we just kind of, with a special tool, we bang on this. It's all, wires and all these different things. And it'll measure how fast that metabolic rate is based on how fast the reflex speed is going. And this lets us know about metabolism. It definitely lets us know about thyroid.
Right, and dosing the thyroid.
Very much so. I think we use it just as much as diagnosis. We probably maybe even more use it for monitoring as we go along. So we are really maximizing thyroid hormone dosing based on how the body responds.
Right. Again, what clues is your body giving to us about how you feel, so that subjectively you are as great as you may look objectively on paper? Because going back to the conventional approach versus the Thyroxone approach is that once those labs look beautiful, usually the physician says you're fine. Yeah. If those labs start suggesting that you're having too much medicine, even if you feel amazing, then it's very common that the dose will be lowered. So we don't want to pigeonhole the tool that we use to say, how well are we monitoring your wellness? We want to make sure that we keep not only your hormone approach comprehensive, but your analyses as well.
Great point. All right, so what else do we have here? So we've got a diagnosis, let's say, and it's looking like low thyroid, and we see it all the time. What's the best way to go about serving that patient? Or let's say that they are already on thyroid medication, like Dr. Bosch had said. I'm calling you Dr. Bosch a lot today. Like Christina said.
You're feeling official.
Is that what it is? That ultimately we might want to switch you off of the synthetic form of thyroid hormone you're on and maybe put you on something different. Maybe. Because here's the deal. What's the best type of thyroid hormone that works for you?
The one that works for you.
The one that works for you.
Yeah. This is a really big deal. A lot of patients will come in and say, I've been told I need thyroid medicine, but I don't want to be on anything that's not natural. Well, okay, I would say that the two of us definitely reached for Nature Thyroid first. However, we do have a certain percentage of patients that just do best on the synthetic form. So the answer is always do what's best for you. When you're on thyroid hormone replacement, this is not you taking a pharmaceutical medication that should fall under some philosophical fight to not be on. This is about hormone replacement. This is something that your body needs, and you're simply not producing enough on its own.
Right. I'd say probably in our experience, it's maybe about 97% of patients will do good on what's called natural desiccated thyroid, NDT. An example is Nature Thyroid. Another example is Armor. Most are really going to do good on that, but when they don't, they don't. They will maybe feel overstimulated. They can't handle the T3 portion that's in these types of prescriptions, and T3 is pretty powerful for some people. I mean, it's powerful for everybody because it normally makes them feel better, but for some people they just it's like too much coffee. And the only way to really handle that for those patients is to give them synthetic T4. But even with that said, we still maximize the dose to give them the best response.
I would say that it's really important to remember that thyroid is a stimulant. I mean, that's what it's supposed to be doing. If you think of a low-functioning thyroid, you think of a body that doesn't have energetic stimulus. So by adding in the hormone, you're stimulating the body. There's many reasons why a person may have overstimulation from their thyroid, and it's not always because it's too much medicine or not the right medicine. It may be because there are other hormonal relationships or nutritional relationships that are not allowing the body to utilize that hormone well.
Yes.
So even with synthetic T4 hormone, we will often recommend perhaps synthetic T3 hormone.
So you can do those in conjunction. So there can be sort of a specially compounded T4, T3 prescription, and for some people that works amazingly well. And I'd say, especially early on, I certainly used quite a bit of T4, T3 compounded. The great thing about Nature Thyroid, or natural desiccated thyroid, it contains T4, activated T3, but also T2, T1, T0, something called calcitonin, and even thyroglobulin are all present in that prescription all at the same time. So it's far more holistic and synergistic in its effects.
Yeah, I like to compare desiccated thyroid hormone replacement to the concept of taking 1,000 milligrams of vitamin C versus eating an orange. When you're having 1,000 milligrams of vitamin C, perhaps it's a more potent, measurable amount of vitamin C that orange is giving you. But that orange is giving you all the synergistic nutrients that only nature can provide so beautifully. So desiccated thyroid, in essence, is that concept. It's whole food nutrition in a way.
Yeah, and all things in their place when it's appropriate.
Of course.
Okay, so then let's talk a little bit about the Thyroid book. So this isn't the actual book, but this is the book cover.
It's a little thicker than that.
Yeah, a little thicker than this. So this is, we're just about maybe 2, maybe 3 weeks out from having this ready to for publication and for purchase for everyone. So we're really excited about this. This is over a decade of personal experience, and between the two of us, over 20 years of experience of using thyroid hormone in this particular way. We've just kind of coined this term Thyroid about this system that we've been working at for a long time, and serving really a lot of patients in this way. So we look forward to this and talking more about thyroid, and certainly about the book as it's getting ready to come out.
So we've had some people already reach out and ask if they can pre-order the book, and the answer is, of course, yes. We never thought of that, but yes, of course, please reach out and ask if you can pre-order the book. We'll be happy to send it out to you. This is especially great for those patients of ours that are not able to reach us here in Arizona. It's a wonderful tool written for you,
yes.
So everything's perfectly understandable, so that you can, again, arm yourself a little bit better with your docs out there, and of course, reach out to us if you need some extra help.
Yeah, the book was definitely designed for the patient. Our first book was still designed for the patient, but it was a lot more detail. It was very intense, about 500 pages, a lot more, sort of research based. But we made this one far more user friendly, patient friendly, and it just explains the entire system of what we're doing here and what a patient, if they do come to even see us, what they would expect in terms of how we are comprehensively looking at the thyroid, and then how the thyroid affects all these other hormones that we keep talking about. Yeah. It's really cool. All right, so
ta-da!
My favorite parts, the artisans of sex. We always like to end with this. So we always want to bring it back to this whole idea of sex, because why not? And we are the sex docs.
Because it's Tuesday.
Right. So the artisans of sex. We always talk about this idea of bringing together art and science, and you can do that with any subject, and you can particularly do that with sex. So that's what we do. So let me start off by talking about the science, and this has to do with sexual arousal and thyroid hormone. So we actually need thyroid hormone to achieve sexual arousal. We often think, again, we go back to libido and this idea, we think about sex hormones and testosterone and estrogen. Those are all extremely important, but you also need thyroid hormone in order to stimulate a certain part of your brain called the amygdala. Now, what's really cool about the amygdala, this is a part of your brain that's also kind of near where the pituitary is. It's kind of in and around that area. And this has a lot to do with your emotions. And it has to do with emotional memory as well. So obviously the brain is about memory, but this is particularly about emotional memory, which has a whole lot to do with arousal. So you can actually channel sort of emotional memories to help achieve arousal and vice versa. So that's sort of some of the science behind going on with what's going on with arousal, but there's a little bit more to it than that.
Well, the art of the sex for us, tying it back into the thyroid, because we started by saying thyroid is sexy, and it is. You need a healthy thyroid to have proper arousal. We understand it now from a more scientific perspective. But what about from a more emotional perspective? When we're talking about the thyroid, remember we mentioned last time, we're talking about your truth and your voice. Literally, it's in your throat. Literally feeling your words get stuck could be a sign that your thyroid isn't working well. This is particularly true when we're talking about good quality sexual intimacy. One of the best pieces of advice we can give when we're being asked, how do we encourage better sex in people's lives? One of the first things we say is, you've got to feel safe. You've got to feel that you're in a relationship that's safe. Yes, all the obvious safety issues, of course, matter, but let's put that aside. We're talking about really feeling safe in exploring the unknown, really feeling safe in feeling good, and really feeling safe in being able to acknowledge that you are sexy. And one of the best ways to help have that happen is to make sure that your thyroid is feeling sexy.
That was a very sexy description. I really like that. I always love to watch you go through your thing with that. So yes, it's true. So there's definitely an art and a science to sex and to arousal and to your thyroid. Well, look, here's what we definitely know for sure.
Hormones are sexy.
Life is sexy. Thyroid is sexy.
We're the sex docs.
We're the sex docs. So thanks for watching. Part 3 next week, Tuesday, 12:30 Arizona time. Part 3 is...
Autoimmune?
I think it's autoimmune. That's what I think we did. Yes. Do I have Hashimoto's? And actually, because of Christina's great question today, it reminds us that we're going to write down, do I have Graves? Do I have an autoimmune condition? And how the Thyroid Zone treatment can help you. So we'll see you all next Tuesday at 12:30.
Have a wonderful week.
Bye.